afternoon, and good evening, everybody. Welcome to another week of the Global Café. My name is Elizabeth Lewis, and I'm a Senior Policy and Project Coordinator here at the IFA. And I'm very excited to be introducing you all to Ms. Ilenia Gheno today. Ilenia has worked as a project manager at Age Platform Europe since 2009, coordinating Age European projects and the re-grant activities of the Age Platform Europe's members. Age Platform Europe is the European umbrella organization of and for older people, gathering 100 associations across the European Union. Age works to raise the aspirations and needs of older people, bridging the gap between older citizens and policymakers. Thus, Age informs the European decision-making process about the challenges faced by older people and supports their active involvement in policy and social advancements and advocates for equality in older age. Within this work, Ilenia contributed to the Age-Friendly Environments Toolkit project, which developed and delivered an online self-paced training for a new professional figure on age-friendly environments. So thank you so much for joining us and very excited to have you here, Ilenia.
Thank you for the invite. I'm really very glad to join you and all the participants of this Global Cafe, and also to see how many interested people in age-friendly environments. Really honored to be here on behalf of Age and on behalf of my consortium, the Age-Friendly Toolkit project.
Wonderful. Well, the first question is just a bit more broad here, and I'd like to just get a little bit, get to know you a little bit more. And if you could tell us about Age Platform Europe and what your role looks like within the organization.
Sure. Well, you gave me already a very well-rounded introduction. My background is in political science and more specifically in European policies. But my interest is in practical implementations of policies, and especially I'm interested into how policies then become concrete plans, actions, and this is what makes the dimension of projects very, very dear to me. As you said, I joined the Secretariat of Age Platform Europe in Brussels in 2009, specifically to work on various European projects in which age is involved. And I particularly appreciate the practical implementations of projects indeed, because I felt and I still feel that they complement and balance the work on policies, which is the strong focus of Age Platform Europe. As you said, we are a network of European network. We are counting nowadays around 100 organizations of and for older people across Europe. Age Platform Europe was established in 2001 with the mission to voice the interests of the almost 200 million older citizens in the EU, and to raise concern on and awareness on what is of relevance of an aging population as we grow older. So our organization involves all the people themselves through our membership in the European debate. We mobilize our members to have discussions also at national level, regional level, and then we bring those discussions up to the European level. So on the one hand side, Age Platform provides indeed a European platform for exchanging experiences and practices to advance on the rights of older persons. And on the other hand side, we inform our members and all the people in general about their rights as European citizens, as residents, on the European policy-making process, how they can contribute to them, and how to monitor the recent policy developments.
Thank you so much for expanding on that. And I'm wondering if you could elaborate a bit more on how Age Platform connects directly with older persons and includes them in their research and their development process.
Yeah, well, in very practical terms, we work with a series of task forces. We have 4 different working groups, and we specifically mobilize the task force on age-friendly environments for this specific project. And we consult our members through the task forces or on ad hoc consultation for whatever policy areas that is interested for them, or it emerges as a priorities at European level. And we work on different areas, the most obvious ones around, of course, healthy aging and care and pension reforms and employment. We work on social inclusion, on elder abuse, on intergenerational solidarity, on gender-based violence, and on digitalization, and of course the discrimination of older persons. So we have a lot of work on around ageism.
Mm.
With respect to accessibility, we also work on the digital parts, so digital accessibility, but also on accessibility of public transport and of the built environment, which is one of the topics that brings me here today, indeed, through the Age-Friendly Toolkit project. At European level, we work then, so we consult our members and we cooperate with them to interact with the European Commission, European Parliament, and other European bodies and agencies, such as the Committee of the Regions, the Economic and Social Committee, the Fundamental Rights Agency. And we team up with other civil society organizations at European level, but also at national level. At European level, we work a lot with the European Disability Forum, with the European Anti-Poverty Network, the Social Platform, and many more. And we team up with them and with our members, especially around one of our ambitions, which is building a Europe for all ages. So a very inclusive society, a society very connected, that connects a lot generations, different generations along the lifespan, and where everyone, regardless of the age, so condition, status, has the right to participate and contribute to the society. So for this reason, we advocate for an age equality strategy at European level that we consider as essential to grow as a society as a whole, and that would be a strategic complementing strategy to the existing European acquis. So that would build up on what already European strategies around the gender, around disability, around children, around LGBTQI plus and Roma people are doing. So we hope that also adding this other layer, the layer of aging to this discussion, to this policy, will contribute to a truly European Union of equality, which is one of the ambition of the European Union. Then on the international side, we also work on similar topics, but this time advocating it at the UN level for a United Nations Conventions on the Rights of Older Persons. And we support the work of the independent expert on the enjoyment of all human rights by older persons. And very last, we are also affiliated as AGE to the global network of age-friendly cities and communities to promote age-friendly environments. And it is indeed via this kind of work that we embark on the European project called Age-Friendly Toolkit on Age-Friendly Environments.
Wonderful. Certainly a robust body of work that Age platform takes on, and some very important and significant work that gets done. So thank you for expanding on that. I think it's a great time to move towards explaining a bit more about the age-friendly work in particular. So maybe you can just start off by explaining a bit more of what the portfolio of age-friendly looks like at Age platform, and specifically what the age-friendly environments toolkit is.
Oh, yeah. So the age-friendly toolkit stems indeed from the work on age-friendly environments. So we have conceived that international organizations like the WHO and then also at UN level, the Decade of Healthy Aging, provided the framework to systematize the action, prioritize the actions around age-friendly environments. But what we felt was that the implementation really happens at the local level, so to the closest level to us, the citizens, and that there was a kind of gap between the framework and the practice. Of course, there are some virtual examples of age-friendly citizen communities, and there are other trainings available. One of the most recent one and very comprehensive one is the PAHO, the Pan American Health Organization, which I could have a look to, and I really feel it's excellent. At least to my knowledge, is the most recent one. But in this landscape, we felt that there is something missing to connect the different dots, and especially to ensure that someone is able to take responsibility for delivering age-friendly cities. So to move from the framework to the practice. And that's where the Age-Friendly Toolkit project steps in. So we started from these questions, like how to sustain the process along the various steps of this very comprehensive framework. And the reply we got was that perhaps we need to have a new professional figure charged of developing and implementing age-friendly environments, which is a real challenge per se. We know that many cities and regions want to become age-friendly, but often they don't know where to start. What are the steps that are necessary to take? What should be taken first? How to manage? How to measure also the process? So the age-friendly toolkit help break these things down into something more manageable with some real-life examples, some case studies that we met and we screened and evaluated ourselves, and with some materials that makes it easier to move from the framework, let's say, to the practice. Um, so in a sense, it's a training that it's really open to many different professionals, because we know age-friendly cities and communities should be built by different stakeholders. So we have local policymakers, we have civil servants, of course, we have social workers, but we also have healthcare professionals, we have housing developers, we have the citizens themselves, the social, the civic space, and so the realm of organization. And everyone is placed in this challenging position of being a part of the jigsaw here, and and they are supposed to coordinate their respective areas of work. And so we said, let's propose a training to define this referent professional for the development of age-friendly cities and communities. So the training doesn't focus much on the framework, which is already covered by the work of WHO, the PAO training, but on the implementation. So aiming at training a qualified technician capable of designing, of organizing, of implementing, and last also evaluating, although this last part is less predominant in our training. So evaluating the interventions across various departments.
Thank you so much for introducing that, and certainly a great tool that is available. I know Luana had put a link in the chat there, so anyone curious can
Thank you.
go ahead and take a look at the link there. Yeah, I'm wondering if you could expand a bit on how the toolkit itself aims to advance age-friendly environments across many European communities and the differences amongst European communities.
So the training itself doesn't have I would say, the ambition of
Mm.
mobilize the whole community, but it's really a tool in the hands of the stakeholders we aimed at, to systematize the competencies and the knowledge around age-friendly environments into something more practical.
Okay.
So it should also be considered that this project, the Age-Friendly Toolkit, didn't last long. It started in December 2022 as part of a European project, as part of a European program, the Erasmus program that financed the whole adventure. And it hasn't been drafted by so many stakeholders in terms of a big consortium, because at the end we were only 6 partners that worked together with different professionals and citizens. And we released the training in January this year, so 2025. So it was quite a condensed time in which
Yeah.
we worked into that. So yes, indeed, as I said, we don't have the ambition to change,
Mm.
but to implement rather. So that's really the
Okay.
focus of the training.
No, thank you for clarifying that. And from what it sounded like, it sounds like the training opportunity is really welcome to many different folks from different sectors of society to participate and complete. Could you elaborate on who would maybe benefit the most from participating in this training opportunity?
Yes, sure. That's a very broad topic because we brainstormed a lot on who should be the target audience if there was a
Mm-hmm.
target audience
Mm-hmm.
since the elaboration of the project, so the proposal phase. And we didn't manage to narrow down the list to few key stakeholders. I would say rather the contrary.
Okay.
The more we were working on it, the bigger, the longer this list
Mm-hmm.
became. Probably because indeed the concept of age-friendly environments is very broad per se. So every
Yeah.
time we were trying to narrow down the list, we felt like excluding somebody and some stakeholders that were really important. So our training at the end is addressed to many different stakeholders. We had teachers and trainers in mind and students in the VAET, so the vocational educational training sector. So we had school and institutes and organization of VET. But we also aim to go beyond the educational sector to train local communities, so decision makers, municipalities, especially at local and regional level. And last, we also wanted to encompass older persons themselves, older persons and their organizations, other NGO working on age-friendly environments and inclusive communities. So really, the list is very, very broad, which added a kind of layer of complexity to to
Yeah.
our adventure. But yeah, so we didn't narrow it down and we kept it open. Perhaps in a future we will be able to tailor more to specific
Mm-hmm.
needs.
Mm-hmm. That certainly sounds like a complicated task to get it all together into one. There's a lot of areas that you can cover. So thank you for explaining that. I see we have a question in the chat here from one of our cafe regulars, Shmuel, who's asking, how, according to your opinion, effective developing and implementing age-friendly environment training can support improvement of social and economic well-being for older persons from poor and low socioeconomic groups of the population?
Well, it's $1 million question, but I would
Yeah.
say for a very uh, not simplistic, but okay, like
Yeah.
to shorten it down, I would say that for me, the major strength lays on the fact that there is a cooperation between different sectors.
Hmm.
And so despite age-friendly environments is very broad, and of course, then the part of social well-being is also taken into account. um, it's the synergies among the different domains of age-friendly environments um, that makes it, I would say, possible, because we know the domain of social well-being per se, it's not really confined to a few topics, but it's in per se an interconnection between different topics. So the added value of working within age-friendly environments is indeed that we don't only tackle one aspect, but we try to look into all the different domains to tackle one specific aspect, then with something more tailored.
Wonderful, thank you. And hopefully that answered your question there, Shmuel. And I'm wondering if we can go into a bit more detail about the actual format of the training itself. I know when you and I spoke previously, you mentioned that there was 5 modules of the training program. I'm wondering if you could explain to our audience what the structure looks like and how these modules are connected to each other.
Sure. Yes. It's very simple, I would say, and not very long. It's the training itself will last only for 40 hours. And it's really condensed in 5 modules. Each module has a short introduction. Sometimes it's written, sometimes we have a video that describes, that introduces the topic. And then we have very short learning units. For each module, we have 3 learning units, which has each of them has a theoretical part and some practical exercises. And then the module is closed by some additional resources. So we have bibliography, case studies, some good practices, and last but not least, of course, the self-assessment exercise at the end of the module. And I would say that besides the models, because you will probably make the connection between 8 petals of 8 domains of the age-friendly environment, um, framework with 5 learning modules in our training. We have a list of transversal topics relevant for each module. So we embedded these transversal topics, so some cross-cutting themes that are relevant across the different learning modules. We embedded them in those modules indeed. So instead of having like 8 petals, we imagine, and then 8 modules, we went for 5 petals with these transversal themes being covered across the modules. I remember, for instance, one of the WHO petal deals with respect and social inclusion. We kept a module on social inclusion, but the issues of respect is then transversally explained throughout the modules. And we have a compilation of 20 key cross-cutting issues. Some of them are very general, as aging, as ageism, quality of life, of course, age-friendly policies, and some are more specific to the professional figure, like the project management part. So you will not find, for instance, one specific unit on aging per se, or the life course perspective, which is on the other hand side what POW offers, which is very well done. But these concepts are then embedded in each modules. And then beyond that, they are also part of the glossary. So at the very end of each module, there is a glossary that explains what has been covered. We also have a virtual assistant, but I would say just for the part that is the learning module per se. So it's not active when trying to
Okay.
take the quiz.
Thank you for that. And I see Fatma in the chat here saying, is the training online? I know that we've sent a link there, but I'm wondering if there's other ways to reach or if it is a program that's exclusively available sort of in the digital realm.
Yeah, so for the moment it's only available digitally, online on PC or on smartphone. So the online training is adapted also for a smartphone user. And it's available in English, Spanish, Danish, Italian, and Dutch, because these are the languages that were covered by our consortium. So the languages that were part of the national languages of our partners.
Wonderful, thank you. And in terms of languages there, it's interesting that it's available in more than one. I'm wondering if that's something that you're also looking to expand upon eventually.
It was an idea. I was in touch with le réseau francophone des villes amies des aînés.
Mm.
So the age-friendly cities and communities from the French part, from the French-speaking communities, and we were in touch to see the opportunity to translate the training in French. It's not that done. We have not really received such a request, so we haven't really
Okay.
embarked
Yeah.
on that. But it's indeed a possibility, as I was saying to to the network. Um, yeah, the only thing is that the project itself is now closed, so there is little room for major changes, although we can still accommodate, I guess, at least one additional language. We
Okay.
were wondering also if Portuguese would be what the request would be. We received almost a request from France,
Mm.
the French-speaking part, and also from from some Portuguese stakeholders. We should be we should be making a choice then at a certain moment.
Yeah, it's a hard decision to make, I'm sure, when everybody can benefit from it. So thank you for expanding on that. I see a couple questions in the chat coming in about the costs and sort of more logistics related to the training. So I'm wondering if you could expand upon where the funding for this opportunity came from, what costs it takes for users to engage in the program itself, and if there's any certifications or proof of completion of this training opportunity.
Yes, of course. But the training is, of course, totally free. No cost associated to that because indeed this is part of a project and it's European public money that have been inputted in the project per se, and all the outcomes of European public money must be for the public use.
Yeah.
There are, of course, some exemptions when
Mhm.
talking about some specific research programs, but it wasn't the case. It's not the case for the Erasmus Plus program. So the training is for free. And I remember the question on certification. Yes, certification is also available after completion of the training.
Wonderful. Thank you. And hopefully that encourages some folks to go check it out and see if you can engage in the training as well. I also have a question here from Carly who's asking if you had any challenges in designing this program and if maybe if you could take a moment to reflect upon obviously there's a lot of opportunity and gaps to fill in this research and training opportunity. So I'm wondering if you could sort of talk about what gaps are being filled and maybe what difficulties you had in creating the program.
Yeah, one of the very first challenging we had was indeed related to the target group, as explained earlier. So for us, we were a bit caught in between the tendency to be comprehensive and the need to be quite practical. And so that was already the very first complexity that we faced.
Yeah.
And another one related to the different phases of the project itself, because
Okay.
it has been done together with other associations. So to clarify, this this project has been managed by six different partners, and each partner had a specific role in the oral process. And besides that, so beside the coordination of our own different tasks, there is also a kind of tight calendar, right? Because we started in end of December 2022 and we closed activities, end of February this year. And we had to really follow the calendar. So sometimes it was quite challenging to keep up with the pace of the things that we needed to do.
All right.
And according to the different steps, we started with interviews, some desk research, so with different consultations with our members and our stakeholders. And then we moved towards the preparation of the professional profile with a curriculum, the development of a curriculum. And only after that, and several rounds of consultation and validations, we moved into the practical part of setting up the tool per se. And there you face, I would say, the reality check. Like you prepare your whole description of the model, how you would like it, and then you face it that, well, but the training is becoming so long if we really stick to the
Mm,
original program. So you need to go backwards to and
that's
then to
fine.
try to refine exactly
Yeah.
all the different elements. So it was a learning by doing experience, and we had challenges around the whole process, but I would say nothing um, really too cumbersome or things that
Okay.
couldn't be really overcome. On the contrary, every time there was a question, it was always also the right questions, like are we really doing what we are meant to do, or are we just deviating ourselves from what we would like to do? How much
Mhm.
space do we allow to each module and to each topic?
Mhm.
So yeah, it
No,
was
that's great.
interesting. Yeah.
Yeah, that sounds like such an interesting process of reflecting as you go and creating it. So thank you for sharing that with us. Carly's also asking some other really great questions here. She's asking if there are any elements of the training itself that were considered to be age-friendly, like the brightness of images, or size of text, or slowing down of video speed. I'm wondering if there's any sort of considerations when you were actually creating the training of how the training itself can be more suitable for all ages.
Absolutely. That's a very great question because
Yeah.
indeed we also paid attention to these elements,
Hmm.
to the accessibility of the overall format, to the language that we used. And I must say that the fact that we had to translate the training from English, that is no one native language, to our own national languages, made it even more clearer how we should have simplified and make some elements and some parts of the training more straightforward to be understood. So yes, definitely we looked into that, and it was a very interesting part of the overall discussion we had. And it was indeed our partner Anziani Non Solo that was in charge of the elaboration of the practical training, that was collecting all this feedback and then digesting and inputting it in the training.
Right. Thank you. No, glad to hear that those were considered as well. A couple more logistic questions in the chat here. We're having a question about how to actually apply for this training opportunity and how long it takes to complete the whole training.
Yeah, so it's a 40-hour self-paced training, totally free, and it's possible just to create your own account just by providing your email, or even log in as a guest. It's feasible, so it's nothing too cumbersome. It doesn't request like 20 different passwords. No, it requires like a very simple and straightforward registration once.
Perfect. Thank you for that. And we explained a bit about the connection that you have with the World Health Organization's global network for age-friendly cities and communities. I'm wondering if you could expand upon the connection that this training opportunity has with the global network and how it aligns with sort of the global standards or perspectives of the WHO.
Yeah, so we know that the age-friendly environments encompass, well, cities, and we have towns, and we have rural areas where um, policies and services and infrastructures are designed to support people as we age, as they age. So it's a very comprehensive approach that embraces the whole life course, the whole life perspective. And through that, we recognize that our environments can either hinder the way we age or support or sustain our healthy aging. So basically, when we think about age-friendly environments, probably one of the first aspects relates to accessibility, but it's well beyond that. It's about, sorry, uh, participation for in social moments. It's about safer neighborhoods, safer streets. It's about services that really work for everyone, regardless of age or ability. So it's much beyond the accessible built environment, so to say, and it wants to include opportunities for civic participation, to social connections, and to fight against loneliness and social exclusion. And so it's indeed a concept that comes from the WHO, the World Health Organization's age-friendly cities and communities framework that detailed this concept into these 8 domains. So we have the one on which everybody really puts his head first is the outdoor spaces and buildings, and then we have transportation, we have housing, we have the social participation, we have the one that I was mentioned before, the respect and social inclusion, civic participation, then we have employment, and there is a last one on communication and community health services. In terms of alignment with the WHO, then we worked on these 8 trainings around these 5 modules and the 20 transversal teams, as I said. And to me, I would like to think of these environments, or it's something that helps me to conceptualize something that is very complex. It's like I see the environments as musical composition. So in music, we have 7 notes and many rhythms. Here we count on, instead of 7 notes, we have 8 domains
Mhm.
that really orchestrate a lot of our lives, because through the environment, either we can strive or we can have difficulties. We can be empowered, or we can suffer
Mhm.
from different discriminations and barriers. Um, I really liked as to make the connection between the bigger framework and us as a different way, as meaning the project and the training, as a different way of dialoguing with those 7 nodes or eight domains.
Thank you. What a lovely analogy. I think that really helps illuminate the connection there. I love that. And we're seeing a lot of comments in the chat from people from different parts of the world. I know you mentioned that one sort of advantage and disadvantage of the training was how broad it was. I'm just wondering if you can confirm or clarify, I guess, for myself and the audience, how applicable the training is for areas outside of Europe.
Well, it is because indeed, well, age-friendly environments do not have like boundaries. Well,
Yeah.
the concept itself is applicable everywhere. What is important to take into account, though, is that every context, every environment has its own specificities.
Mhm.
Of course, the training couldn't go into those, although we raise some concerns that emerge through the practices, and so it emerged through the exchanges with best and not so good practices
Mhm.
that also help. So I would say it's always important to tailor that. And you
Yeah.
gave me a very nice idea for a follow-up project in which, instead of looking into the solutions, we start approaching age-friendly environments from the specificities and so from the challenges of some contexts, some environments. We should start first from investigating what are the most recurrent challenges, and then consider from that on. Perhaps, I don't know, I make a call to the participants. If you are already aware of studies and work in this field, just let me know, because indeed it will be very, very interested to follow up based from another perspective.
Certainly, I think we can definitely speak as well. There's always more work to be done. There's always more to do. But certainly a great start. And we have some encouraging words here from Roberta in the chat, who said, "Very easy to apply, simple and attractive. I just did it and looking forward to starting my course after this presentation from Winnipeg, Canada." So that's wonderful to hear.
I'm very glad. Thank you indeed. And
And
congratulations to the partners indeed, because you see only me, but behind me there are, I don't know how many were we in the team, but 12, I guess. Yes, 12 committed people. And so, yeah, I will refer your kind words also to the rest of the team. They deserve it.
wonderful. Wonderful. And we see a question here from Emily Greenfield. Emily, if you're here and want to unmute to ask your question, you're welcome to. Otherwise, I will proceed to read your question for you.
Sure, I can unmute. I'm not video ready, but here I am. Hi, everyone. Good morning. I'm in New Jersey in the United States, and I was just wondering, in terms of cross-cutting themes, to what extent is diversity and issues of equity among people as they age one of those themes? I'll tuck in another question as long as I'm unmuted here.
Yeah.
Is to what extent do you think the training materials would be appropriate for community leaders and advocates who are more grassroots, not affiliated with a particular organization or are in any positions of institutional power, but care about the issue and want to be more effective in advocating to those who do have such power?
Thank you, Emily, for the question and the intervention. Yes, indeed, it has been meant. It is meant also for those who are not really affiliated to some municipalities, some departments. On the contrary, of course, teamwork helps. So, in case the person taking the training is already at least connected, not affiliated, but knowledgeable of who operates in the environment, it would be much easier then to knock on the right doors and to make the right contacts to advance on something. But I think the training per se is a very useful first step for those who are not much acquainted with the framework, not because they will get an extensive overview of the framework per se, as I was referring. So the PAO training for me, it's much more thoroughful in that sense, but with the practical implementations of it through the case studies, through the different practices that are inserted in the training. So definitely it's conceived for people who are not yet there. It's meant for training a professional figure on age-friendly environments, to build the first step at least.
Great. And what about the other question regarding diversity and equity as people age?
Yes, sorry. Yes, absolutely. Yeah, diversity has been part of our work it was, as I mentioned before. Oh, sorry. The accessibility part has been covered, and the diversity per se as well, because we had different rounds of consultations with various stakeholders and very diverse stakeholders, and each of them contributed to the overall professional development and then the training itself. It's indeed diversity has been in this way embedded. It was something in which to which we made attention since the beginning. So we had a critical eye ourselves when developing the content, and then we submitted what we developed, first the ideas and then the concept to different stakeholders. And beyond that, we made also reference to cultural sensitivity, for instance, and disability in around, of course, beyond ageism and aging in the cross-cutting teams, so in the transversal teams that we had.
Thank you so much.
You're welcome.
Mhm. Thank you for expanding on that. And I guess the next question that I have for you is if you could just expand a bit on um, sort of where the emerge for this training comes from, or the need for this training, and maybe if you could expand on some of the hopes of what this training will add to existing training opportunities.
Yeah. Oh, my chair is moving. So the need for the training, well, the training per se, as we conceived it, originated from the fact that there was a gap. We felt there was a gap between the bigger framework that we saw through the WHO and the implementation. You want to start somewhere building age-friendly environments. What should you do? To whom should you talk to? Which among the different domains? Where do we start? So these were the questions that we had, and we tried to see how a professional figure could help addressing these questions. So back in the time, we weren't aware, for instance, of the PAHO training. We learned it only once our journey was also completed. But quite naturally, our focus was on the connection of the different areas, and on the very practical, hands-on, I would say, approach to the training to complete what already the framework is and the framework was. So two main strengths, I would say, are around the community development, on which we insisted a lot. So how to network, how to engage with the communities, how to embed the work of a professional figure within the community itself, because that's really the starting point. And then very, very soon, we tried to read every step through the person-centered approach that we had in mind. At the very beginning of the project, we worked on quite concise, person-centered approach tailored to age-friendly environments, analyzing what are the needs of the citizens, how to support, how to provide, how to encounter and meet the needs of the citizens as they age. So these were the main starting blocks for this adventure. Then later on during the journey, we as we go on and we release the training, we made some selections, I would say. So we worked on the accessibility of especially the physical space. So we covered housing, transport, and the outdoor areas. Then we moved to the social environment, going through participation, then digital aspects, inclusion and intergenerational cooperation. And last, on the community per se, with the healthcare part support and the information. So yeah, these were the needs that we identified at the beginning, and we structured the work around those needs.
Thank you. And I'm wondering as well how feedback from older adults has been implemented either in the development process or if you've had the chance to sort of hear the experiences of folks who've gone through the training or if you've had any feedback throughout this process of developing and refining.
Yes, so basically we had, I think, 3 rounds of consultations. A very first one at the beginning of the project beyond our desk research was a kind of co-creation session to try to shape the concept itself. Then we have a bigger round on the validations part once we had consolidated the training, the professional curriculum. And last, we had a testing phase for the training itself. So we had mainly these, 3 rounds of consultation. And these in 4 European countries and then a EU level. So we had a working group in Madrid, in Spain, led by our coordinator, Theoma. We had one working group in Gouda, in the Netherlands, led by our partner, Age Friendly Academy, Academy, that oversaw also the elaboration of the professional profile. We had also a working group in Modena, in Italy, led by the partner Anziani Non Solo, charged of the elaboration of the training process, so in the practical implementation of the online training. And a 4th group in Aarhus, in Denmark, led by SOSU, which is the 2nd largest social and healthcare college in Denmark.
Mhm.
So all these working groups were run international languages, as I was referring, of languages of each partner, with their own communities of older persons, of formal informal carers, of public authorities. We had also architects, healthcare professionals, and also random citizens that were joining our working groups. And last, we had also several meetings in Brussels at the Age Platform Europe, where we worked with our dedicated task force on age-friendly environments. So this task force gathers some experts and members interested in the topic or knowledgeable in the topic of age-friendly environments, and they were able to supply us with insights from other countries that were not covered by the 4 countries covered by the project. So I would say, all in all, we had around 200 citizens and professionals that supported this task beyond us, the consortium.
Yeah, that's quite a large project to take on with so many voices to include. And we have another question here, which I'm curious about, that says, was there anybody working from developing countries on this project?
No, unfortunately not. Honestly, I don't even know how far some developing countries are admitted in the program. So I'm sorry for that. I don't know if it's even admitted, but for sure, it was not the case in our project. But indeed, you gave me another good idea for a follow-up
There we go.
a
More
follow-up
future
project.
projects. Yeah.
But if we only find the right funding instruments, of course, because then it's always a matter of money than to run new activities or diverse activities.
Absolutely. And another question here about the process of translating the material into different languages, and if there were any sort of differences that were created in the translation process, and potentially any barriers that you guys had there.
Um, I cannot really say with respect to some specific languages. Um, what we what we encountered as a general, I would say, applicable to many different languages was as a problem was that um, um, the first scripts were in English. Everything was done in English first, and then the translation resulted in having longer text, and so we needed to adapt those texts to fit into the training, so the space of the training per se. But in terms of translation, there are some interesting cases as one term can become, it's very short in English and then can be very, very long in other languages. For
Mhm.
instance, ageism per se, it's a word that it's not really translated uh, in different languages. There are
Okay.
different countries, different languages that already have the proper translation for ageism, but it's not for all countries. So we were lucky enough. I don't know if the Danish colleagues probably had some issues around that. We were lucky enough that in Spanish and in Italian and also in the Netherlands, I think it worked well. But there are cases in which indeed you don't have a proper translation or the translation is totally different. It requires much more space. So it's for a very logistical organization of the content per se in the training.
Right, right. Well, thank you. And just being mindful of the time here, I'll try and squeeze a couple last questions in
Oh,
here.
yeah.
So one of my last questions here for you is, what are your hopes for the future of the AFE toolkit and its impact?
Oh, yeah, I should rely on the work of our coordinator, CEOMA, the Confederación Española de Organizaciones de Mayores, that applied for the recognition of the age-friendly toolkit, the training by the ISCO, which is the European Skills, Competencies, Qualification and Occupations. It's a framework through which the age-friendly toolkit, if accepted and if our application goes on, of course, can be recognized within the ISCO framework and so recognized in Europe. And so, it's a matter of visibility and of using the training widely. Then, as I mentioned, well, we may see an opportunity for translating the toolkit in French if the needs arise, or in Portuguese, or in other languages if there is sufficient mass critique. So if there is a consequent request, and then who knows? Well, you gave me already some ideas for follow-up. I will discuss this with the rest of the team um, to see how to proceed.
Wonderful. And another great question in the chat here from Emily that is topical to our conversation now. She's asking if the material will continue to be updated as time goes on, as obviously we are living in times where there's lots of sociopolitical changes and perhaps the context may shift and vary as new policies and leaders come into place. So if there's any plans to be continuing to update the material.
Yes. Yeah, it's a very good question. Although the project is officially over since the end of February, as the partners are not disappearing and our interest in age-friendly
Mhm.
environment neither, so we are committed, and it's part of our sustainability plan to update not in major things, but of course whatever um, updated that is necessary. Well, we are not going into totally revising part of the training, but if there is the need to actualize part of it because of emerging things, or even to update some practices because new others are coming and are much more fitting into what we had in mind, we will be able to do so.
Wonderful. Thank you for that. And I guess anyone who is interested, either if they're part of an organization or just individually, how can they get more involved in either Age Platform's work or the AFE toolkit in particular?
So the age-friendly, for what concerns the age-friendly toolkit, the project is over, and the work per se was carried out by these 6 partners. It's more the use of the training per se that matters now. So the result should be available to everyone, and we are disseminating indeed largely. To make others being aware of it and use it. As far as then Age Platform use is concerned, um, it's we are a non-profit organization, and if no other non-profit organization that fulfill the criteria for membership are interested to joining us, you're of course very welcome if you want to support the work on equality, on inclusion, on age-friendly environments, of course. Do not hesitate to contact us. Um, our criteria are not super restrictive because we want to voice different concerns. So we go for pluralism and diversity. The major restricting condition for us is that the organization applying should be a non-profit organization of and for
Okay.
people age, or campaigning or working for older people. So our secretariat is very welcoming, our members as well. We work closely together in different fields, in different topics. So you're always welcome to drop an email and have a chat with us.
Wonderful. Thank you so much for that. And unfortunately, we're coming to a close here of our cafe. But before wrapping up completely, I will want to hear your larger takeaway messages from today's discussion. But just to give you a second to gather your thoughts, we had a big conversation. I'll first introduce next week's speaker and topic. So please join us next week in conversation with Dr. Silke Meitzel-Thin on advocating for the adoption of re-ablement in dementia care. So very much looking forward to that session as well. And now back to you if you have any final takeaway messages and thoughts for our audience here today.
Yeah, well, I would say that in the context we are living, we can really feel that age-friendly environments are no longer nice to have. It's simply, it's really a necessity, and we should be working much more closely on it for our own well-being and for the well-being of the generations before us and after us, as everyone. For those who have the chance to grow older. And beyond the tools like the age-friendly toolkit or the PAHO trainings that are good examples, I think that we should close with the message of saying that everyone has a role to play. We as individual, we as part of a civil society, or part of the society at large, also from the professional, from the academic sectors. So we have a role to play in creating age-friendly environments. So let's not wait too much sometimes from the top-down decision, but try to have also bottom-up solutions to make our environments good places to age with dignity and with health and with purpose.
Wonderful last message. Thank you so much for your time here today. And we're seeing
Welcome.
actually a lot of final questions in the chat, which I unfortunately don't have the time to answer. But I'm wondering if you'd be able to provide your email or encourage folks to reach out if they have some
Absolutely.
further questions.
Absolutely. Yes. Absolutely. Feel free. I will be delighted indeed to be in touch with you and have some more time also to perhaps to have bilateral exchanges. So absolutely no problem. I'm looking
Wonderful.
forward to that.
Okay, excellent. Well, thank you so much for your time here today and wonderful conversation, and very much looking forward to everyone to go out and check out the training as well. So have a wonderful Friday, everybody, and we hope to see everyone next week.
Thank you. Thanks indeed.